An appropriate spot to declare a huge hurdle has been cleared.
We're very pleased. We've gone over 98% first dose coverage across our 12 plus eligible population.
Rosier still, more than 71% of that eligible population is now fully vaccinated. The vaccination hub at the Australian Institute of Sport is now offering appointment-free first doses for those yet to get the jab. The Chief Minister maintains national targets should always have been considered benchmarks.
I have always viewed 80% as a floor, not a ceiling. And I think Canberra has demonstrated that it should always have been a floor.
Across the border in Queanbeyan, fully vaccinated residents have something else to celebrate.
Cheers,
as New South Wales took its first steps in reopening, and after 15 weeks of lockdown, barbers had their work cut out for them.
There was about 10 waiting this morning before I even entered.
No, I leave it to the professionals.
But for business operators in these cross-border communities, trying to understand and manage the restrictions that apply to ACT residents is tricky.
Of course, it's very clear on what you need to do to get into the pub. You need to be double jabbed and you need to use a QR code, but in terms of the border and the policies surrounding that, they keep moving all the time.
The Chief Minister says he'll confirm changes to travel restrictions for Canberrans by Friday, but in the meantime he warns that New South Wales will still be aggressively enforcing their rules and urges against non-essential travel across the border. That's left many residents in New South Wales, many of whom work in the ACT, now uncertain if they can travel within their state and still come into Canberra.
It feels a little sometimes like we're just that forgotten corridor in between it. We're sort of a bit of a post-it note from the New South Wales government, perhaps when the ACT government gets a lot of inquiries as to, how does this affect us? They might shoot something over to the New South Wales guys and something might come out then.
Meanwhile, back in the capital, the government set up a task force to help businesses find ways of operating outdoors in public spaces to increase capacity. But industry advocates argue most won't bother and say it's a poor substitute for a greater relaxation of restrictions or an increase in financial support.
Having a couple of tables and chairs outside and a car park or on a laneway means jack all.
I recognise not every restaurant, cafe or eatery, coffee shop will be able to use this, but hundreds will. And so we're doing what we can in that context.
The government says it's taking a cautious and managed approach as it strives to avoid overloading the health system once restrictions ease. It's already under pressure even now, with 2 more cases linked to the special care nursery at the Centenary Hospital and 18 people being treated in Canberra hospitals for COVID-19, 7 in the ICU. Harry Frost, ABC News, Canberra.